Okay. So we're going to continue with the resuscitation again. The objective is at the end of this lecture is that students would be able to demonstrate how to assess a collapsed person. So if you see a patient who collapses in front of you, how would you deal with that patient? And how to perform basic life support and introduction to the AAD or the automated external defibrillator, okay? The automated external defibrillator is the defibrillator that you use for the lay person, that the basic life support train the lay persons. And anyone can do it. You don't have to be a physician. You don't have to be a healthcare worker. Even if you're an engineer, even if you're just a technician or a worker, you can do that. If you're going to go through the chains of survival, any patient or any person who has some, he becomes sick or he has some chest pain or anything, you have to recognize that early. So early recognition and calling for help is important. Early CPR is important. Early defibrillation is important. And post-resuscitation care after that comes. So you can see there, here's early, early, and early. So you have to intervene as fast as possible, as early as possible. Cardiac conditions. Cardiac conditions are the most common cause of collapse and injuries. Suspected heart attack. How would you know that this patient has a heart attack? What are the symptoms that you're going to think about? Okay, pain. Well, chest pain. Okay, excellent. So chest pain is one of the main signs of heart attack. And usually it is a chest pain that is that is basically like a belt or a pressure on your chest. And immediately you should call 911 or 997 here with the crescent, or go to the nearest emergency department to be assessed. So the general signs of that is pale and cold, clammy skin. Okay, we're talking about the patients with suspected heart attack or suspected MI. Rapid, weak pulse. Rapid, shallow breathing or shortness of breath. Nausea, vomiting, pain in the chest, possibly radiating into the arm, the jaw, or the back. Sweating. Most patients with heart attacks or MIs, they will be sweating and they have some sweat on the face. So to start the primary survey and performing CPR and doing the recovery position, you're going to go through the basic life support. So these things should be done as part of the basic life support courses, but I'm going to talk about them online because unfortunately it's not going to be easy to do it without doing it and practicing it on a mannequin or a patient. But hopefully with the skill lab, we can practice this on a mannequin. Here is the algorithm for the adult cardiac arrest algorithm. So you need to know this as part of your ALS or BLS training. You're going to check, first of all, to verify the scene safety. Make sure the scene is safe. If the scene is not safe, you should not come near to that person. You're going to check if the patient is, or the victim is unresponsive. Shout for help. Activate the emergency response system. Call 911 through the mobile device or a cell phone, and get the AED and the emergency equipment if there's someone around to help you out. Look for no breathing, or if the victim was only gasping, and check for pulse. When you're checking for pulse, definitely you should have to make that done within 10 seconds. If you cannot feel any pulse within 10 seconds, or you're not sure after 10 seconds, you would assume that the patient doesn't have pulse, okay? You have only 10 seconds to make that decision. If he has normal breathing and has a pulse, just monitor and wait for the emergency to come. If he has no normal breathing and he has pulse, provide rescue breaths, one breath every 5 to 6 seconds, around 10 to 12 breaths per minute. If no breathing and only gasping and no pulse, then you start CPR. At this time, all the scenarios, emergency response team or backup is activated. CPR, you're gonna have to begin cycles of 30 compressions and 2 breaths. Again, 30 compressions and 2 breaths in between, and use the AAD or the automated external defibrillator as soon as it's available. If the AAD arrives, then you check the rhythm, and if it's shockable, the AAD will give the shock. If it's not shockable, you're gonna have to resume CPR. Again, it's gonna be 30 compressions with 2 breaths in between. This is more simplified. Unresponsive victim, no breathing or no normal breathing, gasping, activate the emergency response, get the defibrillator, start CPR, and check the rhythm and shock the patient if it's indicated, and repeat that every 2 minutes. Push hard and push fast. Airway management. So you can see here an unconscious victim. Here the airway is closed and you can see the mouth musculature and soft tissue is blocking the airway. But here, if you do the head tilt, chin lift, the airway will be open, okay? And here the airway is obstructed with a piece of a foreign body, and this will obstruct the airway. This basically you will need to do an intervention to open it, okay? So when you're dealing with the victim who is unconscious, you're gonna approach safely, check the response of the patient, call for help, call a code blue if it's in the hospital, call 911 if you're out of the hospital, open the airway, check for breathing. So approach safely, make sure the scene is safe for the rescuer or you, for the victim, for the bystanders. You don't want to have another victim in addition to the first victim that collapsed. So again, scene safety is highly important. If the scene is not safe, do not get involved or help that patient, because this will cause further injuries to people around. Check for response. Put your hand on the shoulder of the victim, shake him, check if he's awake or not, talk to him to check if he responds or not. You can ask him, hello, can you hear me? Are you okay? If he responds, just leave him as you find him and call the response, emergency response, and find out what is wrong with the patient, what's happening with him. He might he may tell you, oh, I have diabetes, I need my injection. Oh, I have headache, I need to go to the hospital, I have my medication at home. So you can ask him and he will respond and tell you what is the problem. If no response from that victim, then you're gonna call for help, call 911, and then wait for them until they come. While you're waiting and he's not responding, what kind of intervention that she's doing to that victim? What do we call that? She's trying to open the airway. So what method that she's using to open the airway? Okay, head tilt and chin lift. So the head is tilted backward and the chin is lifted upward. So this is the maneuver that we use for unconscious victims. If it was a trauma patient, then you're gonna have to use the jaw thrust method. So checking for breathing. Look, listen, and feel for normal breaths for 10 seconds. Do not confuse agonal breathing with normal breathing. Sometimes they have agonal breathing. What is agonal breathing is basically disrupted breaths. So basically it sounds like that. So it's like intermittent breath sound that happens every few seconds. They're not regular. And you can see like this guy is like snoring. It's because the airway is obstructed, and that's why you hear these breaths. If you have any doubts, act as if breathing is not normal. So if you're not sure, again, assume the worst. Assume that the breathing is not normal and the patient is not breathing. If he's not breathing normally, no signs of chest movements, as we guys mentioned, no signs of breathing, no feeling of breath against your ear or your face. Agonal breathing occurs shortly after the heart stops in up to 40% of cardiac arrest. So patients with no heartbeats, initially they will have agonal breathing, and then they will spontaneously stop breathing. Described, this is the agonal breathing, described as barely, heavy, noisy, or gasping breathing, recognized as a sign of cardiac arrest. So be careful when you're hearing agonal breathing. Chest compressions. So how many chest compressions are you gonna give? For adults, it's gonna be 30 compressions. And how many breaths? It's gonna be 2 rescue breaths. So you're gonna count 1 to 30, 1, 2, 3, 4, up to 30 compressions, and then you're gonna stop. You're gonna give 2 rescue breaths, and then you're gonna continue giving the 30 compressions. So what is the ratio of compressions to breathing in an adult patient? 30 to 2, exactly. So 30 to 2, this is something that you have to know by your heart for adult patients, because pediatrics are different. Okay, we're going to talk about pediatrics soon. If not breathing, as we said, do not panic. Chest compressions, see the methods. You put your left hand against the chest, your right hand crossed fingers through your left hand, and then you're pushing down using your whole body, not through your elbows. It's gonna be with your full body into the chest. Hopefully we're gonna show you that being done in the skill lab. Place the heel of one hand in the center of the chest, place the other hand on top, interlock the fingers, and compress the chest. Rate is 100 to 120 per minute. Depth is 5 to 6 centimeters through the chest. Equal compressions and relaxation. When possible, change CPR operator every 2 minutes. Rescue breaths. Before we used to give the mouth-to-mouth breath, but currently is not being practiced. You're gonna have to use a device, and even the device with the current COVID pandemic, this is not recommended. You just have to go with compressions, and you will not give rescue breaths unless you're gonna have a bag valve mask to give the breaths to that patient, okay? But if the patient is not, before the COVID pandemic, you will just give him a breath through the protected mask. So you're gonna combine compressions and breath and rescue breaths. As you guys said, it's gonna be 30 to 2 in terms of ratio. Any questions so far? If you have any questions, please write it down in the group chat, and I will answer it as soon as I notice it. Okay. Compression only CPR. Compression only CPR means that you're not giving any breaths, you're just going with the compression. And this is what we are doing out of hospital during the current pandemic. So if the rescuer is unable or unwilling to perform rescue breaths, it is expectable to perform compressions only CPR. However, chest compressions with rescue breaths is the method of choice for CPR by trained lay rescuer and professionals. Professionals, they're talking about healthcare professionals. We're doing it in the hospital, and we're doing it using a bag valve mask to give the rescue breaths. The bucket mask is an effective barrier device that has one-way valve, which prevents the casualty exhaled air being inhaled by the rescuer. Again, this does not apply to the COVID pandemic. We used it before the COVID pandemic. Okay, any questions concerning that? Again, if you have any questions, please feel free to write it down in the chat group. Now we're going to pediatrics. Pediatrics is almost the same as adults with a few differences. I think the main thing you need to know is how many rescuers are involved. Here we're talking about 2 rescuers in pediatrics. Later we're going to talk about 1 rescuer. 2 rescuers mean that you are 2 persons doing the resuscitation or the CPR, and 1 rescuer is that you're by yourself doing the CPR. Okay. So again, victim scene safety, victim is unresponsive, you're gonna call for help the same as the adult. You're gonna check for breathing the same as the adult. The only thing is that you're gonna give more breaths, 1 breath every 3 to 5 seconds, or about 12 to 20 breaths per minute. Do you guys remember what was the breaths that you're gonna give to an adult unconscious patient in cardiac arrest? Do you remember how many seconds? So every 3 to 5 seconds for adults, or how frequent you're gonna give the breath for adults? 5 to 6 seconds, excellent. So for adults, it's gonna be 5 to 6 seconds. Here in pediatrics, they need more oxygen, they need more breaths. So you're gonna give them more frequent breaths if they are not breathing and they're having a pulse. If they don't have a pulse, then you're gonna have to use that with 30-to-2 ratios. And when the second rescuer returns, then you're gonna switch 15-to-2 ratios compressions. Okay, so in pediatrics, you're gonna use either 30-to-2 ratios, the same as adults, or 15-to-2 ratio in terms of compressions to breaths. And when would you use 30-to-2 or 15? What's the difference? Is basically if you have 1 rescuer or 2 rescuers. If the second rescuer is available, then you're gonna go with 15. So here we're talking about 2 rescuers. You're gonna use 15-to-2 ratio of compressions to breaths. If the ED arrives, then you're gonna give the shock if it's indicated, and that's it. Here we're talking about 1 rescuer. In 1 rescuer, you're gonna begin with 30-to-2 breaths, and you're gonna use 15-to-2 ratio if the second rescuer arrives. Okay? One thing to remember here in the pediatric cardiac arrest is that if it was witnessed sudden collapse, it means that you have seen in front of your eyes the victim collapse in front of you. He was awake talking to you, and then suddenly he collapsed. Unwitnessed means that you were passing by and you found someone who's unconscious, and then this is considered an unwitnessed collapse. If it was a witness, activate the emergency response system immediately before you start CPR. Okay. If it was an unwitnessed collapse, you immediately start CPR, and after 2 minutes, you activate the emergency response system. Okay. So again, think about witness sudden collapse, and make sure you differentiate 30 compressions to 2 breaths and 15 compressions to 2 breaths ratio and when to use them. Again, 30 to 2 is going to be for one rescuer. 15 to 2 is going to be for two rescuers. These are for pediatric population. Okay, defibrillation. Defibrillation, for the basic life support, it's going to be the automated external defibrillators. The AED is basically an electric shock box used to stop the electrical activity of the heart when it is in a life-threatening rhythm. This allows the heart to reestablish an effective rhythm, and it goes back to normal rhythm. The EAD will do the following. Will analyze the presenting rhythm, and this will be done for you by the AED. It will only advise a shock for a shockable rhythm. It will advise the operator step by step. So the AED will guide you through the whole steps of giving the shock. An EAD can be used safely and effectively without previous training. And most of the people who use the AED are actually laypersons who are not working in the healthcare field. Therefore, the use of AED should not be restricted to trained rescuer. So anybody can use the AED as long as they are familiar with. Again, the chain of survival. You have to act early, recognize early, start CPR early, start the defibrillation early on. So these things will help the patient to survive the incident. So understanding defibrillation, this is the heart rhythm. This is sinus rhythm. The heart's pumping action controlled by electrical system. This is back from your cardiac physiology. Electrical rhythm normally very recognized. Normal heart rate rhythm is called sinus rhythm. And normal heart rate, as you guys know, is between 60 to 100. And what happens if you have an arrhythmia or ventricular fibrillation, which is the most common arrhythmias that happens with cardiac MIs or heart attacks. As you can see on the EKG, it's just a massive, unpredictable, messy line. يعني باختصار شديد خرابيط يعني ما في شيء واضح, and there is no pattern to that. So VF is the most common rhythm in sudden cardiac arrest, almost 90%. Electrical problem in nature, so it's mainly electrical. It is a chaotic rhythm, results in quivering of heart and results in loss of pulse. Quivering of heart means that it's just quivering. It's like يعني زي اللي بيهز بس ما في there is no productive movement. Ventricular fibrillation would result in brain damage within 15 minutes and death in 10 to 15 minutes. So patients, if you don't help them or intervene within 5 minutes, they will have brain damage and they might die after 10 or 15 minutes. So you can see here the electrical current is going through the sinus node, AV node, and then goes into the Purkinje fibers. In defibrillation, you can see the electrical field is happening everywhere. So it's just electricity, randomly chaotic, happening everywhere. So to understand defibrillation, you can see that the defibrillation is happening everywhere, and then you shock the patient, you see the image, and then the heart will restore his sinus rhythm and will start beating normally. Okay? It's like doing restart to your computer or to your video game device, and then things will go back to normal. So defibrillation, it may correct ventricular fibrillation. It doesn't mean that it will fix it all the time. Use the DC current delivered across the heart. A successful defibrillation depolarizes the heart cell and makes it back to normal. Defibrillation is the only effective cure for ventricular fibrillation. So it's the standard of care in terms of intervention for ventricular fibrillation. Okay, single rescuer. We've been through most of these things. You're gonna have to attach the AED for CPR, before CPR, and follow the voice prompt. So the AED will give you voice instructions. The second rescuer will call for help and gets the AED and attaches to the patients if you have a second person to help you out. And you're gonna follow the voice prompts. Minimize interruptions of CPR, because every time you stop CPR, this will cause more damage to the brain of the victim. If alone, attach the AED before starting CPR. If two rescuers provide good quality CPR while the AED is brought to the scene and is turned on and pads attached. Interrupt CPR only when it is necessary to analyze the rhythm or deliver a shot. So these are the only times that you're gonna stop CPR to assess or analyze the rhythm or deliver a shot. Defibrillation safety. So when you're pressing the button or giving the shot, make sure that the patient has the 5-point check. Make sure that nobody's touching the patient. Make sure that there is no pacemaker, jewelries, hair on chest is attached well, damp or wet skin, or there is no water around the patient, because you don't want to give electricity and then end up with injuries to someone else. Do not use in heavy rain, and do not use it if they lay in a pool of water, and do not use it in an explosive environment. Attach the pads to the victim, and you can see that you're attaching it to the front chest, and here on the right chest and the left chest. And then you're gonna have to analyze the rhythm and do not touch the patient. And you can see that nobody's touching the patient, including the rescuer. Because if you touch the patient, you're gonna get the shock the same as the patient. Shock is advised. The device will tell you that the shock is advised. And then you have to clear everyone. Everybody's clear. Shock is given or delivered. Make sure that the top, the middle, the bottom, and yourself are all clear, and then deliver the shock. Remember, always check that no persons are touching the patients, including yourself. Make sure that nobody's touching that patient. And then you give the shock. After the shock has been delivered, follow the AED instructions, and usually going to continue with the compressions and rescue breaths. Again, it's going to be 30 to 2 in terms of ratio. And no, if there was no shock advised, you're going to continue following the AED and continuing CPR. Any questions so far? Okay, if you have any questions, please write it down in the group chat. So we're going to talk about children and AEDs. Standard AEDs are suitable for both adults and children older than 8 years old. So you cannot use the defibrillator for children younger than 8 years old. If the children is between 1 to 7, pediatric pads or pediatrics mode should be used. So they have a specific mode for them. Children younger than 1 year old, usually they don't need a shot. And usually we don't use it as part of the BLS or ELS guidelines. Do not use an AED on an infant less than 1 year, okay? And you can see here the AED, it's an example of an AED, and you can see how to attach the pads, how to clear, how to do the CPR, and its steps. You can click on and off, you can attach the pads here. This is the button to deliver the shot, and this is the voice or the sound that will give you. And this is, you can choose either more than 8 years old or 1 to 8 years old in terms of the pads, and use it for the accurate patient. Primary pad placement in pediatrics, you can use it on the front chest, or you can use it actually one on the front and one on the back. This is only for children mainly. And what if you see this has occurred? So we're talking about CPR and compressions and safety. A patient who's decapitated. CPR obviously won't be beneficial because this is basically the patient is already dead and it's an irreversible damage. There is no point of doing CPR for such patients if they have any signs of irreversible death. If he has decapitation, his head is chopped off, or if he has rigor mortis, he's been dead for 2 days, then there's no point of doing CPR. Any questions? Okay, if you have questions, please write them on the comments in the group chat. The last thing is going to be choking. We're going to talk about how to help a victim with who's choking on a piece of foreign body, meat, or food. Usually, this is the way of doing this. What is this called? This is a maneuver that is we use for clearing the patient's Heimlich maneuver. Yes, excellent. So the victim is holding his throat with his hands, and then as a rescuer, you're gonna have to put your fist against the upper abdomen, and then you thrust the abdomen all the way up to the chest to expel the foreign body that the victim is choking on. For pediatrics, it's gonna be, you're gonna put the child on your hand, right hand, and then back slap him to expel the foreign body from the child. This is just a video to see how would you do it. So if the patient cannot speak or cough and conscious, this is the way or the time you're going to do the Heimlich maneuver. So you see the fist here is just against the abdomen, and you're going behind the patient. And then both hands on the patient's abdomen or upper abdomen, and then you're going to push upward. So if it doesn't dislodge, then you're going to start CPR if he becomes unconscious. And this is the way to help a patient who's choking on a foreign body. Okay, good, excellent. So here we talked about the basic life support. This is basically the same thing that we have mentioned before. This is all the way with the same CPR guidelines. And that's it. Any questions that you guys have? You can raise your hands or speak on the mic if you want. It's all fine. Okay. Anybody have any questions? Okay, or this one. Okay. البعد بنكون نفس الكفاءة عند باقي الدفعات. Well, this is يعني هذا سؤال عام ما له علاقة شو اسمه. أعتقد إنه واحد الزملاء is asking إذا كانت الكفاءة بالنسبة للتريننج. ما أعتقد إنها تكون إذا كانت everybody is doing it online now يعني كل العالم. I don't think الكفاءة راح تختلف بشكل كبير. It's going to be just temporary intervention. I don't think would be a big deal من ناحيتنا. Okay. Any other questions?